Today, what we have is, a plea for rapid tests, a plea to recognize airborne transmission, a plea to stop pretending that bits of plexiglass and a blue gaping surgical mask is enough to protect anyone against anything, because it isn't. We're also pleading for faster access to third shots, and now that we know what Omicron's got in store for us. So these are the things that we've been begging for, and it does seem to be falling on deaf ears. The consequence to that seems to be pretty clear to me. We're going to have a pretty significant escalation. It's not a question of if, but when Omicron really starts to take off here. It could be quite soon. We might be able to hold it off with the travel restrictions we have, but it's going to involve having to close lots of things if we don't move with alacrity. And when I say alacrity, I mean yesterday. We cannot have people sitting in restaurants without masks and without air mitigation. We just can't. That's just going to have to stop. And either restaurants are all going to have to shut down, or they're going to have to start scrubbing their air. You can't do neither. It's going to have to be one or the other. I'm concerned about schools staying open. If we fixed restaurants today, I think schools would stand a better chance. But even then, I'm not entirely optimistic. With the advent of Omicron, I think everything hinges on whether we're willing to acknowledge airborne transmission. I don't see how we're going to keep a lid on things, vaccination aside, because Omicron is quite vaccine evading. I don't know how we're going to be able to keep everything open if we cannot start tackling air quality and start giving better public health guidance around masks and around air mitigation at work and in places like restaurants. There's just a huge amount of inertia, because the implications for acknowledging airborne, we also have to say we don't have any safe hospitals. And we don't, but we're not admitting that. And I think it's a lot easier to not admit it than it is to face it. We'd have to say we have been dismissing unsafe work refusals unfairly. We're going to have to go back and revisit all of those. We're going to have to take a responsibility as a government for a lot of mistakes and a lot of under preparation and a lot of remediation and a lot of mitigation. It's going to be expensive. It's going to be embarrassing. It's going to be brutal. That's what a government is facing when it's deciding whether or not to acknowledge airborne transmission.